All right, so today we're going to be talking about a very common drug known as lithium. And you guys should know that lithium is a mood stabilizer, and it's primarily used to treat bipolar disorder. Now, bipolar disorder is when you have the pendulum swinging when it comes to your emotions. You'll wake up one day completely, profoundly depressed, you can't get out of bed, and then what ends up happening is you develop mania or manic episode where you're completely euphoric and you can't stop doing things. That's bipolar disorder. And it can lead to a lot of complications. So what we do is we give people lithium to kind of stabilize that mood. Now, what you all should know is that the biggest concern, as from the nursing perspective, that we're gonna be dealing with when it comes to lithium is the toxicity potential. So you have to know the therapeutic value of 0.6 to 1.2. And this 0.6 to 1.2 really keenly reminds me of the creatinine value. And the creatinine value is, of course, assessing kidney function. Now, it doesn't mean that this is, that's not essentially the most important aspect of this value, but we use what we know to figure out what we don't know, right? So keep in mind, we know creatinine, you should know creatinine, 0.6 to 1.2, well, that's the same value as lithium. And the reason why it's important, the relationship between the lithium and the kidney, is because impaired kidney function can lead to lithium toxicity. Anyways, so generally speaking, the toxicity values won't really be manifested until your value is about 1.5 or more. That's when you're gonna see the profound lithium toxicity symptoms, which I'll get to in just a bit. So let's get to it now. Side effects. Generally speaking, your side effects of lithium toxicity involve GI disturbances and central nervous system disturbances as well, CNS issues. Your GI issues primarily involve nausea, vomiting. You also have issues like diarrhea, which are not, the GI. You have issues with polyuria, polydipsia because of the dehydration. And your CNS manifestations primarily manifest as tremors, okay? Now that's your initial GI disturbance, your initial side effects. Once that value starts going above, or it gets to 1.5 or beyond, then you start having the more profound signs and symptoms of lithium toxicity, which generally include profound nausea, vomiting. Your patient can't stop vomiting, and the CNS gets really involved. You're gonna develop ataxia or an ataxic gait. That's when the patient has a hard time walking and ambulating around because of the excess of lithium in the bloodstream. The nervous system cannot communicate adequately with the other tissues, primarily your muscles. So that's what the signs and symptoms are. You should know that there's certain drugs that can lead to toxicity. And to start off, we'll talk about hydrochlorothiazide. Hydrochlorothiazide is a diuretic, right? And it gets rid of fluids. Well, your body, in an attempt to fix the this thing that the medication is causing, it reabsorbs sodium to hopefully reestablish fluid volumes, right? But you keep taking this drug, we keep dumping it. The problem is that as the medication prompts your kidneys to reabsorb that sodium because of a compensatory mechanism, it also reabsorbs lithium. And lithium, now you can't get it out of the body, toxicity. So that's how hydrochlorothiazide can lead to lithium toxicity. Another drug would be your Nsaids. Can't draw from back here. So your Nsaids, whether they're COX-1 or COX-2 inhibitors, they're gonna be limiting the blood flow to the kidneys, especially in patients who are susceptible. Your patients who already are older, who have a decreased GFR, glomerular filtration rate, because of all the micheladas that we've been drinking, throughout our youth, or patients who already have a history of kidney issues, because NSAIDs limit that blood flow. It doesn't mean that if you guys or I take NSAIDs, we're gonna have kidney failure. No, but you have to have some of those components intact, whether you're older, whether you already have an underlying issue, or you have a susceptibility to kidney issues. This will exacerbate that issue. So both of these drugs can lead to lithium toxicities via different mechanisms, but now you guys understand the why and the how, because the why and the how are super important. Now, medications like lithium can be exacerbated toxicity by hydrochlorothiazide and NSAIDs, but it can also lead to secondary issues. First of all, it can lead to diabetes insipidus. Now, this diabetes insipidus, you should look at my other videos where I explain this one, but this has nothing to do with blood sugar issues. This is dealing with polyuria because of, it's nephrogenic, so it's caused by kidney issues. And so this medication can lead to alterations in kidney function that will eventually lead to diabetes insipidus, where you have a lot of fluid coming out. I'm talking 18 liters a day, when your average is about 2. So it's very problematic. Another condition that lithium medications can cause is hypothyroidism. And so what you should know is that the thyroid gland naturally utilizes iodine from your diet, so it can uptake it in here and use it to produce T3 and T4. But if you're taking lithium, it so happens that lithium interferes with that reuptake of iodine, and now you have less iodine to produce T3 and T4, and that's what ends up leading to your hypothyroidism. Excuse me, I was going to say your toxicity. So again, lithium can cause hypothyroidism because the thyroid gland can no longer reabsorb its iodine and utilize it to produce its T3 and T4. It's also important for you guys to know that lithium is teratogenic. Teratogenic. What that means is that it passes a placental barrier and it can cause deformities in the fetal development. Primarily, it'll cause a valvular disorders. It will prevent them from being not manufactured, but developed adequately. And so people that take lithium, they may develop teratogenic effects. So lithium is contraindicated for people that are pregnant or that may be in that age range, or there's something about their history that may make it likely for them to develop to be pregnant. And so in essence, guys, that is your lithium. That is, those are the components that you guys have to know. Let's recap real quick. Lithium, used to treat bipolar disorder. It could also be used to treat depression, but it's going to be a mood stabilizer. Know the therapeutic value of 0.6 to 1.2. Anything above 1.5, you're going to have profound signs and symptoms of toxicity. Initially, basic GI and CNS issues, tremors, nausea, vomiting. But when you have more profound toxicity, ataxia, movement is going to be impaired, level of consciousness, even seizures may develop. So remember that hydrochlorothiazide and Nsaids may lead to toxicity, and the intake of lithium may also contribute to the secondary formation of diabetes insipidus and hypothyroidism. I hope that made sense, guys. Please follow me. Please subscribe to my YouTube channel. I'll learn NCLEX now.